menopause or the perimenopausal periods at a later time. So, what else would I say would affect? So, also habits. So, you remember how we said cholesterol levels fluctuate or change when menopause begins? So, for example, if you had like a high fat diet and you had high levels of cholesterol, so I don't know if this is a conversation altogether, another conversation altogether. But cholesterol can also be used to generate estrogen in the body. So that's what I noticed, that if, for example, an airplane crashed, women are more likely to survive than men, because like there's fat deposits in our body where you can also like generate fuel and just the body's needs for. So if you have some cholesterol as well, that may also delay the menopause. If you have less cholesterol, you may aggravate intensity and the onset of that menopause. So that's why when everyone is like, oh, I need to lose weight, I need to be fit farm, I need to be a size 0, I'm just like, I don't know about you, but how would you like your menopause to be? Hot or cold? So if you're really, I'm not saying don't lose weight, but keep a healthy weight for your stature and for yourself and for your needs. So of course, if you don't know what your health needs are, you are going around losing weight with every Tom, Dick, and Mariah. Don't do that. You need to know what your body needs are before you are able to engage in such quests. So these are the things that I would say. So no multiple sexual partners. Keep abreast of your health. Check your family history. If you've had cancer before, that may alter things. So don't worry yourself, or know what you need to do. Also, like what else did I say? The host of other things that I mentioned in the past: smoking and drinking, and drug use, illegal drug use. So if you also had addiction issues in the past, it may also affect that. A concert was about to start. So as I was saying, don't do those things and you'll be better for it. But of course, again, you might do all these things and you may still get a rapid onset of perimenopause or really intense perimenopause. So, but that's what doctors are there for. You will get. So, but that's what doctors are here for. They are here to help you, to give you hormone. So the whole spiel is about hormone replacement therapy. I want to reiterate to women that there's treatment for the symptoms that you feel. Whether it's minute and you're just like, it's just hot flashes. My friend, she used to bleed a bucket. My dear, sufferness is not competition. So if your friend bleeds a bucket and you're having hot flashes, still go and take care of yourself. Because again, it might be a symptom of something entirely different and you think it's perimenopause or menopause. Because who told you that it's menopause? You are just assuming. Because as we've said, you have to have 12 consecutive months of no period for you to know that you now entered menopause. But that means you have to wait 1 year. And there's a lot of things that could happen to someone in a year. So check with your doctor and let's know what the issues are. So small plug here for diagnostic institutions that I know that I can recommend. So I made a list. Let me see. So this list is not exhaustive and they change from time to time. So there's Mabifos in Ilorin that does like diagnostics across all range. Mabifus, Mabifos. So they do a range of what you call diagnostics. You can go there and do your test and stuff. First diagnostics in Lagos, you can do your test. Ropep is a dental clinic, but also thank God that I made this list, is that dental, you may also have dental issues because estrogen, they change your hormones as well, because you have dental issues. So Ropep is a good dental clinic and it's run by a woman. So that's my favorite thing about it, is that it's run by a woman, and sometimes you're explaining these symptoms to men and they have no idea what you're talking about, or they will dismiss you. So these are institutions that have women there as well, and there are institutions that I know that they have medical I don't know, medical practitioners of what, also FMC better, and my colleagues work there as well. One of my colleagues is the president, Dr. Labilo. I'm plugging her. Is also an expert in her field in FMC Better. So please feel free to visit this individuals, these institutions, if you have questions, if you need to do diagnostics and do your health check as well.
Wow, wow, wow. Thank you so much, Dr. Bilqis. This session has been so expository because women are facing a lot of issues basically concerning their health in Nigeria. And for the fact that we do not have, okay, in quotes, we do not have a lot of information. A lot of women do not have access to health facilities. A lot of women do not have access to health care in the real sense in Nigeria. It's really important that they continue to get information and access to where they can, get all of this, health care facility. Thank you so much, Dr. Bilqis. So we have one question here. The question is that what are the roles of stress in perimenopause, and at what point should a woman be concerned if the woman is planning to have more babies?
So stress is a tricky situation, because most people be like, oh, I'm stressed, that's why my menopause came early. And I want to say that there's different kinds of stress, because there's stressors every time in your life. But are we talking about traumatic stress responses, or we're just talking about regular stress? And now people will say I'm too deep, but every conversation has got to be deep. You can't be superficial about people's lives. So because if you're going to the market, you're in Lagos traffic, your body has adjusted to it. That's regular stress. But if your husband is beating you, or someone is harassing you at work, or you had a sudden loss, huge loss in your business, or your partner has never done a health check and you don't know if he's able to reproduce, you don't know his sperm count, you don't know his sperm motility, and you're saying, oh, he's stressed, my dear, people should see a doctor. So stress is relative, because for some people, stress makes them add weight, and so then they then have more fat deposits, and then they may have more estrogen, so they may not even exhibit symptoms of menopause. So what kind of stress is it? Is it a traumatic stress response, or it's just stress like the regular stressors of life? Everything in life is a stressor. I'm just doing a thing and somebody's here playing guitar behind me. It's a stressor. But and how do you respond to those stressors? So you need to be sure. And then there's different things that trigger different reactions and responses in our bodies. So stress is a tricky conversation to have. So I can't just flag stress as a causer or causative agent for menopause. So we need to discuss what kind of stress it is. I'm very mindful not to give people an umbrella response to certain things, but stress can definitely can definitely determine the impact, intensity, onset of menopause and perimenopausal symptoms. But please find someone to talk to, a therapist, a doctor, to determine what kind of stress it is and what response or what solution can be used to modulate the impact it has on your life and on your health. So I think there was another question. Was it stress and fertility?
The second question was, at what point should the woman be concerned, especially if she's planning to have more babies?
So concern is relative. For example, if maybe you notice that your menstrual cycles are dwindling, it may be because of other things. So it may be that maybe you are pregnant and you don't know, or you may have uterine fibroids, which can alter, depending on the location, can alter the kind of symptoms that you have. So you may be having more bleeding or less bleeding, or you may have like cervical changes. So, for example, your cervix can change. So it can become I don't want to. It can become precancerous, and so that can cause you to have changes in your menopausal or in your like menstrual and reproductive health altogether. So I don't want to alarm people, but there are different things that can cause that to change. But if you're someone who often has difficulty with conception, so some people have 5 kids, but each of those 5 kids, they have to spend like 5 years trying for each of those children. So that may just be something that gets progressively worse as you get older. For some people, it's just that your body has changed, your body has evolved, and it's not as receptive, of birth, or birthing or becoming pregnant as before. Um, there may be changes in your womb. There may be changes in your diet that's causing alterations in your fertility, in your fertility health. There may be changes in your diet. So you remember I first started with concoctions and stuff, or this roadside stuff. So many people take different things. So for example, I attended a workshop and I was just told that in a public health workshop that certain soaps contain mercury. And mercury is one of the things, it's a red flag. Mercury is a red flag in reproductive health, in mental health. So imagine that you wash yourself with it, they named it Crusader soap. Crusader soap. So Crusader is very popular in Nigeria. My mom owns a cosmetic store line, so I know that Crusader is a big deal. And Crusader contains high amounts of mercury. And you use this Crusader to maintain your color, as we say in Nigeria. But you don't know that it contains mercury. And so that may be affecting and impacting your fertility. That's one. You may be eating fish so some people say, oh, there's original Titus and there's fake Titus. I guess some of those fishes, maybe the fake Titus is high in mercury, or some kinds of fish. So some people just go to the market and they're like, I just like variety, anything. You don't know what kinds of fish contain what elements. So, for example, in some countries, their cod contains high levels of mercury, but you don't eat Nigerian fish. You only eat imported. So you are going there using your money to buy problems and buy fish that is high in mercury. So that may be it. Or you are using drugs or medications or vitamins, as people call it, or supplements, and you're just like, oh, my friend uses this supplement and it is great for her. Her skin is glowing. Yeah, your skin will glow, but the fertility issues will also abound. So that may be some of the things that you're encountering as well. So be mindful of things that you use, that you ingest. Also paint. So you know how people are painting houses different colors. Some houses they're like, please put gold in my this thing. Some of that paint contains lead and mercury, or the house. I don't use I don't use palm. I don't use rubber. I have to use the best asbestos. I hope you know that asbestos is not good for your lungs. And if you are having issues with major organs in your body, your fertility is not priority for your bodies. So, for example, if you have like kidney issues, you may have difficulties also with fertility because your body is really concentrating on not allowing you to die. So, fertility is not a priority. If your lungs are having, you may not know at this point, your body will just channel its energy to that and it will not mind fertility. If you are having liver problems from maybe medication use, so people that work in the market and they have a customer that brings this little sachet, in Nigeria they call it akapo, or like everything,
Yes.
or
Yes.
stress drugs. So they'll be like, after every stress, once you just use that thing like this, my dear, no more stress. So you are using steroids and your body is on steroids, so you may have fertility as well. So these are some things and painkillers. So people use painkillers indiscriminately. So you are using Felvin every day. Yeah, Felvin 5 and 6. So, but yeah, expecting not to have fertility issues, or you are using stronger narcotics and opioids. So you have morphine in your akapo and you don't know, and you're saying, but this thing is very nice. once I use it like this, or you have a drug that your doctor has recommended that it should only be used for 2 months, and you said that when I used that drug, everything was great. I'll keep using it, and you just keep using it. It's going to affect your fertility, especially if it has hormones in it. So these are the issues you have to be mindful.
Thank you so much, Dr. Bilqis, because as you're just explaining, I'm just thinking of all of these things that you're talking about. I will cite a particular example. Currently, there is something that is like cancerous right now in Nigeria, like people injecting different kinds of, I don't know what they call it, vitamin C, vitamin A in syrup, in injection form directly into their veins. I don't know what they call it. It's like rampant right now in Nigeria. You know, those kind of things. I think that women really need to be mindful of stuff that they inject into their body system. It might not have effects now at the time when their skin is glowing, all of those stuff that they say, but then all of this is are waiting for them probably at their later ages. Thank you so much, Dr. Bilqis. So as we round up this webinar today, I want to ask one last question, and that is that how can women navigate this crucial period successfully? How can, women manage this period, the symptoms that comes with perimenopause and the menopause?
So there are different ways to manage it. The two main ways are adjunctive management or adjunct management and medical management, like using medications. So I want to reiterate again, perimenopause and menopause is not a death sentence. It's not, don't be scared of it. And it can be managed. It is manageable. It has been managed, and you can live a very fruitful and productive life in your perimenopausal period and your menopausal time and everything. And the perimenopausal period usually lasts an average of 7 years. So yours might be 1 year, yours might be 7 years. So just keep that in mind and keep an open mind about the length of it. So I'll start with the gentler ones. So for example, hot flashes. So you can take a warm bath. So never take cold bath when it's hot. Or you can just keep like a wet towel and use it to pat yourself. Sit by a fan. Wear flowier dresses, stuff like that. Change your diet, more greens, so that you have more water retention, less salt. So that you are not sweating a lot. Because if you are sweating a lot, you become dehydrated, and you are more likely to sweat and blah blah blah. No drinking. Drinking is the base of most of the problems, and no smoking, because those things will raise your body temperature and it will alter your enzymes and your hormones and everything, and your liver function, and to just mess you up. Be mindful of the medications that you're using. So for example, some people have been using a medication that has worked for them for years and it's great, but once you come into your perimenopausal period, it may actually affect your perimenopause negatively, or they may stop working because you are now in your perimenopausal syndrome. So some drugs work with other hormones. So when those hormones drop, they don't work very effectively. So that's why I said you have to keep abreast with your doctors. So sleep problems, if you're having sleep problems, you can either use, so an adjunct treatment for that is you drink yogurt towards your bedtime, and that should help sleep. Or some people, exercising will help, or you can see your doctor and get medications to help you sleep. See your doctor. Don't go to the, what do you call, the chemist and say that
Chemist.
I want to mention a drug, but I feel somebody
Chemist.
will go now and ask me that doctor mentioned and vampire. Don't go to the roadside or your peddler or your supplier. Don't go there and get it. And some people use a drug and the side effect is that it causes them to sleep, and then they start using that drug indiscriminately because it helps me to sleep. So please, because it can affect other things in your life. And if you are someone who suffers and lives with addiction, please also see your counselor or your guide or the walking addiction place and tell them that you're having perimenopausal syndromes, and they'll alter the dosage of your drugs, and or they'll give you an adjunct drug to help you to have the same feeling or the effect with your drugs that you're addicted to while still managing the perimenopausal syndrome. So If you're having mood changes as well, you may want to see a therapist to help with more like behavioral cognition and self-management, what do you call self-regulation. But if it's like you're having almost manic episodes or depressive episodes, there are medications for it. And I'm serious, and that's why I went to the highest range of it. So don't say, because I'm now menopausal, does that mean that I'm mad or whatever? How can I have a manic episode? Anybody can have a manic episode. So if you're having manic episodes or you are having increasingly worrisome anxiety, panic and anxiety attacks, please see a doctor and they'll give you medications to help you through that time. You don't have to be on it for the rest of your life. As you can see, it's a period, right? You can wean you off of it, or you can choose to keep on it, because some people may have had like mental health struggles in the past, but they never had anybody help them assess it and maintain it. So this can be your window of opportunity to start taking care of yourself in that manner. Vaginal and bladder problems. So for the vaginal dryness and atrophy, usually we recommend like a topical cream. I will not mention the names because in the past when I've mentioned names, just for people's knowledge, so that when you're consulting with your doctor and he recommends something, you can say, oh, I've heard that before, that can give you peace of mind. But then people go outside of this and then start using it by themselves indiscriminately, and that's very dangerous. So they are vaginal creams. So if somebody's telling you, you use a drug, because most people are afraid of using medication, on top of menopause, and that's why using drugs. I'm not interested. So there are topical creams that you can just apply to the place. So it doesn't even have to, nobody has to know. Nobody has, you don't even need to tell your partner, just apply your thing and go about your daily business. If it's bladder problem, so this can range from a level of difficulty to another. So if the bladder problems can give you medications, just like we give people that have prostate cancer, or prostate enlargement, that have bladder issues, they're not able to. So we can give you those medications to help you make your bladder wall stronger so that they can hold on, so you can control it, or we can give you one that can help you to control your sphincters. So those are the things that control the outlet of urine. Yeah, it's working. Yes, so that you can help control your bladder better, or we can give you we can put a ring around your sphincter, your vagina, your urethra, so that it can help that place to be tighter, so that you are able to control the passage of urine. Or you can just wear a pad. So there are urine pads that are scented and everything. Pads. You don't even have to worry yourself. Overnight pads, and they are even more comfy. In my experience, and I'm going to share this personally because we are women, and I feel that most times we don't talk about these things, and because everyone is ashamed of me. When I have kids, I use the bladder pads because they are more efficient and they are fancy and they are fine. So when you are wearing it, everyone's thinking, you just snapped back. My dear, you not snap back anything. I'm wearing bladder panties. So because they are fancier, they are designed to be nicer because they feel like you wear it throughout the day, so they're nicer. So you can change if you're a person that swims, you can wear it in the swim change room and all of that. So please feel free. They are so fancy, they are so nice. I feel like I should change all my pants to bladder pants. So decreasing fertility. If you are reaching menopause and you are still doing IVF or you are going on a fertility journey, please feel free to freeze your eggs. Collect your eggs, freeze them in an egg bank, and you can use them till eternity. So you don't even have to be fertile for you to continue to have babies. You can just go there, collect your babies, like you collect your money from the bank and then fertilize it and go about your business. So don't be scared. So if you're a woman and you're saying, oh, I'm getting older and my family will reach menopause at
Hi, Dr. Bilqis. Hi, can we hear me? I think Dr. Bilqis' network went off again. So we've been having conversations on management of perimenopause and menopause symptoms, a condition that affects a lot of women starting from the age of 45 to 55. And Dr. Bilqis Williams has spoken quite extensively on what perimenopause is, what menopause is, and how women can manage menopause. And she has spoken about some of the symptoms, which could be hot flashes, inability to sleep, and a whole lot of symptoms that she has mentioned on this webinar today. And also, she also mentioned some remedies. She talked about the medicinal remedy and also the other type of remedy. She spoke about for women having hot flashes. She said that you can take warm baths at night before going to bed. She also mentioned that you can, kind of relax, sit beside the fan so that you can get some good breeze. Then she also mentioned about changing your diet. She mentioned more greens. That cannot be, we cannot overemphasize this enough. More greens, more fruits, more vegetables, more greens, less of processed food. She also spoke about less salt. Please reduce salt intake in your meals. Reduce salt intake in your meals. She also mentioned that no drinking. She mentioned about young girls taking shisha or even adults taking shisha on all of those stuffs, that please reduce that because it could lead to early start of menopause and early experience of menopause symptoms. Furthermore, she also spoke about being careful about taking medications. Please see your doctor. If you're experiencing any of these symptoms, see your doctor. This is very, very important. And I am very, very appreciative of Dr. Bilqis Williams today. Please, you can follow her, ask more questions if you want her, but you need to set up a meeting with her to be able to speak to her because she's quite very busy. But you can set up a meeting with her and follow her on her Instagram and I left that in the chat box. And also, if you want the full video of this webinar and all of our other webinars, please subscribe to our YouTube channel, Girls Count Initiative, or follow us on all of our handles, Girls Count Initiative, and you will be able to access this. I have spoken at the start of the webinar that we spoke about PCOS last month, which was really quite insightful. The previous month before that, we spoke about immunization for children, and also the one before that, we spoke about family planning, methods, contraceptives, the best one for each woman, how a woman can know the best one for their body system. All of this are on our YouTube channel. Thank you so much, everyone, for coming to this webinar for the November edition of the Protect Mom and Child webinar, where we spoke about the management of perimenopause and menopause symptoms in women. And Dr. Bilqis Williams gave a lot of information and did justice to it. I'm going to say thank you to Makoyi 11 for joining, to Dr. Diola Odus, thank you for joining. To every single person that joined this webinar today, thank you so much. We look forward to seeing you at our December edition of the webinar as well, whereby we'll be bringing another global health professional, a doctor or a nurse, a medical lab scientist, a public health specialist, to the conversation seat for the December edition of Protect Mom and Child webinar, EduMumCare. Thank you once again for joining. We really do appreciate you and have a lovely night. Good night, everyone. Bye for now.